Bonjour à tous et à toutes et bienvenue à ce webinaire organisé par l'Association internationale des instituts nationaux de santé publique sur comment les instituts nationaux de santé publique adressent les questions sur la vaccination contre la COVID-19 et les difficultés d'information et surtout les hésitations de la population. Alors, ce webinaire va se tenir pendant 1 heure de temps. Et le temps que certaines personnes se connectent, nous allons introduire quelques notions importantes. Il s'agit d'abord remercier le CDC Atlanta à travers tous les États-Unis qui ont facilité ce webinaire et le secrétariat, bien entendu, de YAMFI. Nous leur disons merci beaucoup. Et moi, je suis Dr Yen Hervé et je suis le vice-président du réseau africain de YAMFI. Je suis à votre service pour animer ce webinaire. Et le co-modérateur de ce webinaire, c'est mon président, j'allais dire, le docteur Ario Rioleusus, qui est de l'Ouganda, qui va prendre la seconde partie de ce webinaire pour les animations. Merci au président et au modérateur. Merci à tous, en tout cas, d'avoir répondu présent à cet appel pour que l'on mette ensemble des idées pour résoudre des questions essentielles de santé publique. L'interprétation est simultanée en français et en anglais et les participants peuvent sélectionner dans leur boîte de dialogue la langue souhaitée. Et il y a les sous-titres automatisés sont également disponibles seulement en anglais. Et les participants aussi sont libres de sélectionner et d'envoyer des informations, des questions dans la boîte de dialogue qui s'affiche en bas de leur écran. Alors, il faut savoir aussi que ce webinaire est enregistré. Et l'enregistrement et les PowerPoint qui seront proposés seront mis à la disposition des participants après le webinaire. Je voudrais rappeler que ce webinaire vise à partager des expériences et des stratégies dans le but d'aider les instituts nationaux de santé publique africains à lutter contre la désinformation et les rumeurs liées au vaccin contre la COVID-19, ce qui entraîne aussi, et tout ce qui concerne les hésitations à l'égard de ce vaccin. Et le but ultime, c'est d'améliorer l'appropriation et l'adoption de la vaccination contre la COVID-19 dans les pays africains, sur le continent africain. Donc, la première partie de ce webinaire sera consacrée à l'introduction, à des mots introductifs par des experts, deux experts du CDC africain et de l'Institut national ougandais de santé publique, qui donneront chacun des présentations de 10 minutes maximum. Ces présentations visent à partager leur expérience et des propositions de stratégie et des solutions face à ces deux questions que nous voulons résoudre aujourd'hui. Et la deuxième partie du webinaire sera une discussion ouverte entre les participants et puis les différents partenaires des instituts nationaux de santé publique avec lesquels nous travaillons au quotidien. et les acteurs de terrain qui se sont connectés. Et ces interactions seront animées et couvertes donc par le co-modérateur, le président de ce réseau africain de l'Association internationale des instituts nationaux de santé publique, le docteur Iriolexus. Donc, vous pourrez également poser des questions dans la boîte de dialogue, comme je l'ai dit, directement au conférencier. Voilà l'introduction que je fais. Et avant de donner la parole au conférencier, j'avais une introduction très rapide à faire pour ce qui concerne le Burkina Faso. Je vais partager ainsi mon écran. Excusez-moi, ça va venir.
On peut voir votre écran, docteur Rien.
Parfait. Voilà, donc merci encore. Je voudrais donner en 3 minutes l'état de lieu de la vaccination contre la COVID-19 au Burkina Faso. Et il faut savoir que le Burkina a élaboré très rapidement un plan national de la vaccination contre la COVID-19 pour couvrir au moins 70% de sa population, qui compte 20 millions environ d'habitants. Et la campagne a été lancée le 2 juin 2021 passé. Et vous le savez, dans un contexte marqué par le déni de la maladie et des rumeurs anti-vaccination. Donc, ce que je vais vous présenter en termes de tableau, constitue l'état de lieu du 3 septembre 2021 passé. Alors, il faut savoir qu'au Burkina, nous avons une cible que nous voulons atteindre, comme je l'ai dit, de 50% de la population, avec plusieurs étapes consécutives, progressives pour couvrir cette population-là. Nous avons, dans une première partie, mis l'accent sur l'intégration, en tout cas la vaccination du personnel soignant, que ce soit du secteur public et privé, des militaires, des paramilitaires et des personnes surtout à risque du fait de leur âge, que ce soit des personnes avec des comorbidités ou bien celles qui sont âgées de plus de 65 ans. Alors, la deuxième étape a nécessité l'intégration des personnes à risque du fait donc de leur âge, comme je l'ai dit, 40 ans et plus, et de celles vivant avec des comorbidités. Et nous avons aussi intégré aussi du personnel en charge de la sécurité publique. Et donc, progressivement, nous avons pu couvrir l'ensemble de la population avec, premièrement, 3% de la population qui devait être couverte, dont avec un nombre de 651 000 habitants. À la fin de la deuxième phase, on devait couvrir 17% de la population avec 4 millions environ d'habitants. Et dans le but ultime de couvrir au moins les 50% donc de la population avec environ 15 millions d'habitants qui devaient être vaccinés. Et les personnes qui devaient être prises en charge, c'était les populations déplacées internes, les personnes d'âge compris entre 18 et incluant les 40 ans et puis qui présentent aussi des comorbidités importantes. Alors, il y a eu l'intégration des sites au niveau des grandes villes et l'extension de ces sites-là au niveau de tout le système de santé, et avec plusieurs stratégies, la stratégie fixe, la stratégie avancée, et puis des stratégies aussi spécifiques dans les zones les zones à défi sécuritaire. Et donc, à la longue, actuellement, nous avons à peu près 2000 sites ce sont des sites de la vaccination, et ça comprend les hôpitaux de district, les centres hospitaliers universitaires, régionaux et certaines structures publiques et privées ou para-publiques. Donc, à la date du 3 septembre passé, nous avions enregistré avec un total de 120 000 personnes vaccinées au Burkina. Et donc, la première dose de AstraZeneca était administrée à 83 000 personnes. Et vous voyez que la deuxième dose est faible, avec un total de personnes de moins de 16 000 personnes. Et nous avons aussi, après le AstraZeneca, introduit le Johnson & Johnson. Et actuellement, nous sommes à 37 294 personnes qui ont été vaccinées sur l'étendue du territoire. Il faut savoir que dans la première étape, nous avons mis l'accent sur le personnel de santé. Et actuellement, au niveau du pays, nous avons à peu près la moitié du personnel de santé qui a été vacciné. Et en termes de MAPI, c'est les incidents qu'on a pu enregistrer. Il faut dire que nous avons des incidents majeurs, mais notons qu'il y a une faible notification de ces incidents-là. Mais nous avons en tout cas en termes d'incidents graves, une faible notification, à peu près 2 cas que nous avons reçus. Alors, pour terminer, pour la situation de Burkina sur le vaccin, il faut dire que nous sommes dans un contexte de déni de la maladie. Il faut savoir que les populations, jusqu'à présent, n'y croient pas. Et il y a cette introduction controversée du vaccin AstraZeneca, puis de Johnson & Johnson, qui ont créé des polémiques. Et actuellement, les gens ont peur de la vaccination. Et malheureusement, ça se passe dans un contexte où il y a une faible communication sur la maladie, faible communication même des acteurs de la santé sur la maladie pour convaincre la population et sur le vaccin. Mais nous avons quand même des progrès sur l'adhésion progressive des populations à risque. J'allais dire les populations qui ont un intérêt à se faire vacciner, c'est les voyageurs et c'est les agents de santé. Voilà ce que je voulais donner rapidement en termes de messages sur le Burkina, et je comprends qu'à peu près c'est des questions qui sont similaires pour les différents pays qui sont autour de notre pays. Et je serais vraiment heureux, et nous serons tous ravis de comprendre et d'écouter les autres expériences des autres pays et des autres organisations et partenaires pour qu'ensemble nous puissions lutter contre ces rétentions, contre cette faible adhésion de la communauté ou de nos populations face à la vaccination contre la COVID-19. Je vous remercie. Maintenant, je pense que nous allons passer à la prochaine étape, c'est celle d'introduire, de laisser mon collègue docteur Iriolelus introduire les deux présentateurs de CDC Africa et de son collègue de l'Ouganda pour nous parler un peu de la situation d'ensemble du continent africain et aussi de la question particulière de l'Ouganda. Et après ça, nous allons commencer les échanges. Merci beaucoup, Dr. Rio Lelux. À vous.
Thank you so much, Dr. Hien. You hearing me?
Yes, we can hear you. We can hear you.
Great. Thank you very much, Dr. Hien, and welcome all participants. And of course, thanks to IANFI and for organizing this very important webinar. And of course, again, thank you, Hien, for initiating this regional IANFI Africa Network webinars, which I think is the beginning, and we shall be having many more to come. So our next presenter is Bob Omoda Amodan. He is a fellow of advanced field epidemiology with the Uganda Public Health Fellowship Program in the Uganda National Institute of Public Health. So it'll take us through a very interesting study which he did, and I think it's quite informative. So I'll invite Bob to share his screen and start the presentation. Bob, you're welcome.
Thank you very much, Dr. Rio. Sorry, I'm in a hospital setting. You might be getting some background noise, but I hope it will be still fine. Allow me to share my screen. Is the presentation okay?
Yes, it is. Thank you.
Okay, thank you. Yeah. Hello, everyone. My name is Bob Omoda Amodan. Like Dr. Rio has already introduced me to you. I want to thank you for inviting me to this very important webinar, and I appreciate it so much. I am a field epidemiology fellow in the Uganda Public Health Fellowship Program under the Uganda National Institute of Public Health. I will be sharing with you on a very interesting topic about COVID-19 vaccination, COVID-19 vaccine misinformation in Uganda. Let me move my slide. My slide is not moving. I think my network is hanging. Okay. Our COVID-19 vaccine acceptability study was inspired by the coverage of various, but it was inspired by the fact that the coverage of various vaccines in Uganda is still suboptimal. For example, there was a study that was done by one of our colleagues here last year, it found that the HPV coverage was as low as 22%. Even with great benefit that the HPV vaccine brings along, Uganda still faces issues of suboptimal vaccine coverage due to, in part, of negative media reporting, side effects of the vaccine, and other vaccines such as DPT also face barriers such as misconceptions that that the vaccines are fake, especially in Kampala. We went ahead and conducted a study in Kampala and Ankole sub-region. Those are two sub-regions within the country. We chose Kampala because it had the highest number of COVID-19 cases that time, and Ankole sub-region had the least number of cases at that time. So in Kampala, we chose about randomly 3 divisions, and then in Ankole, we chose 3 districts. We conducted this cross-sectional study with a mind of collecting information from the 3 components, that is household survey, focus group discussions, and key informant interviews. So for our qualitative data, 1 focus group discussion was done in each district. And then additionally, the 4 key informant interviews were held in each district with the district chairpersons, the district health officers, and the assistants of those persons in the district. And then in our study, we found that 92% of the respondents had heard about COVID-19 vaccination. Just information about whether they have heard about it, they were 92%. We also noted that radio stations did spread the messages about COVID-19 most widely, with about 60% of the people getting from radio as compared to other strategies, like you can see in this graph. The largest proportion of respondents, that's to say around 44%, had mixed information about COVID-19 vaccination. If you can see that this was about mixed, positive, negative information about the vaccine. As we thought to identify beliefs around the vaccine that might not be true, we found that almost a half of our respondents believed that the vaccine would cause serious health complications. Another 41 thought that the vaccine was only going to be tested in Africa to kill Africans or something like that. While 1 in 5 people believe that the vaccine could cause infertility. So there are varying issues around the safety of the vaccine, like you can see in this country. Despite all aforementioned beliefs and negative perceptions about the vaccine, we are able to see that 85% of our Ugandans were willing to take up the vaccine at that time. This study was done at around February, the beginning of the year. And just to give you a little more hint on that, it's to our surprise that they believe that COVID-19 vaccines would not be effective is one of the biggest reasons for non-willingness. People thought that, yes, there are issues of it not being safe, but the biggest issue is it is not going to be working. It's not effective at all. And then when we looked at our focus group discussions, very interesting things came up. One of which was that it was revealed that for better uptake of the vaccine, leaders should take the vaccine first. They thought that leaders are not going to be taking the vaccine. So why would we, other Ugandans, take it first? So they thought it's better the leaders take it first. So from these reasons, we drew a lot of conclusions that I'll be sharing later on. But I want to again share with you a few issues about the factor that were associated with lower interest of taking the vaccine that we noted in our study. Information on vaccine safety and living in urban areas versus rural setting were more associated with reduced intake of the vaccine. So again, we see that as a very serious factor. What are the implications of this in the national response? Whereas we recommended to the Ministry of Health as a program that actions should be put in place to demystify the myth and the negative information about the vaccine that we have seen in this study, we as a public health fellowship program under one of the small studies with the leadership of one of the fellows called Elayete Sari, conducted a study in May 2020 to understand the benefits of vaccines, especially the COVID-19 vaccine, among 800 hospitalized COVID-19 cases in the National Treatment Unit. In this short study, we found that none of them got severe infection at all. So people who were actually infected at that time none of them got a severe infection because they had had a shot, which was at least 2 doses. And 2.6% were infected, yes, with the virus, and they were hospitalized, but it's that they also had 1 dose of the vaccine on it. They didn't have at least 2 doses of the vaccine. We therefore asked the Ministry of Health to popularize this information that we had got from this study. We presented in very many forums within the Ministry of Health, and we saw this coming in radio stations, in televisions within the country, trying to tell the people that the vaccine has this benefit. It's really protecting people from getting severe infection. We, again, under the leadership of one of our fellows called Edrisa Nsubuga, we did a community dialogue within the same month of May 2021, still on vaccine willingness, safety, and the efficacy concerns. The results also indicated that increased willingness and reduced safety and efficacy concern. Increased willingness was there. And then also there was reduced safety and the efficacy concerns around the vaccine. So because of these 2 interventions, we see the program trying to make sure that the vaccine hesitancy is one thing that we are fighting, and the vaccine coverage is growing steadily in the country. We also made a few recommendations at that time. One of them was that we should enhance more of our works in the urban centers, urban areas within the country. We need to popularize information on vaccine hesitancy and how to deal with it. Then we also encouraged our leaders, the local leaders and the national leaders, to take the vaccine shot fast, which actually happened. We saw our president taking the vaccine at some point. We saw the Minister of Health taking the vaccine at some point, and that was very good, and it encouraged a lot of people to take the vaccine, and so we were fighting a lot in the vaccine hesitancy. I want to acknowledge the institutions of Ministry of Health, US CDC, and then the local governments where this study was conducted from, and then Makerere University. Thank you very much for listening. Over.
Thank you very much, Bob, for that wonderful presentation. I believe questions will come through the chat and probably at the end. So let me take this opportunity to introduce our next speaker, and that is Dr. Raji Tajuddin, who is the head of the Division of Public Health Institutes and Research at Africa CDC. Popularly, I call him Taj, and I think that is how close we are. Taj, you're welcome. Please share your screen and make your presentation.
All right, no, thank you so much, Alex. Let me try to share my screen. No, 1 minute. Okay. Can we see the screen now?
So we can see your screen, but it's a Zoom. It was an internet page.
All right, let me try again. What of now?
Perfect, thank you.
All right, no, thank you. So good afternoon, greetings from Africa CDC. Chair, co-chair, distinguished colleagues, ladies and gentlemen, I bring you greetings from the Africa CDC. So I will take you through what I think National Public Health Institute can do to address COVID-19 vaccine misinformation and hesitancy. And as rightly introduced by Rio Alex, President AMFI Africa, the head of Division of Public Health Institute and the research at the Africa CDC. So this is just overview. In the next 10 minutes, I would just take you through overview of what we've done as Africa CDC to really understand the landscape as far as COVID-19 vaccine perception is concerned on the continent, and what we've done in terms of solutions to improve uptake of COVID-19 vaccines, and of course, key takeaway points. So by way of introduction, as we all know, COVID-19 continues to be a dynamic and evolving pandemic on the continent of Africa, just as it is everywhere in the world. More than 2/3 of our member states have experienced what we describe as a third wave, and this third wave has been much more serious, including Uganda and some other member states. And this third wave has been much more serious in terms of the number of cases and in terms of fatality compared to the previous first and second wave. Of course, we have also seen a lot of variants of concern emerging with serious implications for COVID-19 vaccines. As of yesterday, the continent has recorded over 8.2 million cases with over 200,000 deaths. And of course, you will agree with me that for us to be able to control this pandemic, there is need for development and availability of safe and effective vaccine. And much more importantly, these vaccines need to get into people's arms if we are to control this pandemic, which underscore what we are actually discussing today on this webinar. And of course, as I mentioned in my last point here, any vaccine will require sufficiently widespread willingness to accept it for us to be able to achieve that population level immunity. So late 2020, that's from August to December 2020, we did conducted COVID-19 perception survey on the continent of Africa. So this was a survey that was jointly conducted by Africa CDC and the London School of Hygiene and the Tropical Medicine. The aim of that study was to investigate the public knowledge and perception of COVID-19 and COVID-19 vaccine. And the supposed outcome was to guide us in terms of what do we need in terms of communication and engagement strategy that will support the rollout of an eventual COVID-19 vaccine at that time. Because when we did carry out this survey, there was no approved, in fact, there was no COVID-19 vaccine at all. But as Africa CDC, that discussion of what will happen when COVID-19 vaccine does come on board started since June 2020, 6 months before the first vaccine was eventually given emergency use authorization. So this was a survey that was carried out in 15 member states. This cut across all the 5 African Union region. And in terms of methodology, it was mixed methodology that combined face-to-face with computer-assisted telephone interview. So all in all, we had over 15,000 study participants for the survey. So this is just an overview of the research all in all. So let me just take you through some key findings as far as that survey is concerned. One, we discovered that 4 out of 5 Africans or respondents were ready to take the COVID-19 vaccine when it does become available. And this readiness to take the vaccine actually varies from Ethiopia, that had as high as 94% acceptance rate, to DR Congo that had acceptance rate of 59%. In terms of reluctance or hesitancy to take the COVID-19 vaccine, some of the key reasons there were: one, people who have seen COVID-19 related misinformation or disinformation were not ready to take this vaccine. 2, people who also think that the threat posed by COVID-19 is exaggerated were also not willing to take the vaccine. And people who actually consult social media for information were also in the majority among those who are not ready to take the vaccine. And the last thing here is that those who have not seen anybody, that's come down with the virus, with COVID-19, we're also not ready to take the COVID-19 vaccine. Colleagues, ladies and gentlemen, you will agree with me that the landscape has changed between that time and now. In fact, one of the factors that is driving increased uptake of this COVID-19 vaccine now is what people have seen coming out of the third wave. People have seen a lot of cases. They have seen our healthcare facilities getting overwhelmed. And of course, people have also seen a lot of people succumbing to the COVID-19. So this has changed the mindset of significant number of people. And we're actually looking into that data as part of our COVID-19 vaccine confidence project as African CDC, and we hope that when that data does become available, we'll be sharing with colleagues on this platform. In terms of our specific reasons, there are people who do not trust that this COVID-19 vaccine is going to help them in any way. So for those people, they are not ready at all to take the vaccine. And people who do not believe the virus exists, we're also not ready to take the vaccine. And of course, some people felt that they are not in any way at risk of coming down with the disease, so why should they subject themselves to the vaccine? And of course, some people also believe that the vaccine will actually give you the disease that is meant to protect you against. So these are some of the key reasons behind, specific reasons why people were not ready at all to take the vaccine. Now, in terms of the different information or misinformation, we discovered that for those who actually believe that COVID-19, there's some conspiracy around it, is a planned event by foreign actor. About 38% of them were not actually ready to take the vaccine. And people in Africa, and people also believe that as Africans, we are being used as guinea pig as far as this COVID-19 vaccine, a clinical trial is concerned. We're also not ready to take the vaccine. Of course, we remember that around that same time was when, there were these two scientists from from France, who made some sort of statement, on the media, and that statement actually went viral. So that also fueled a lot of rumor and also, led to increase in the level of hesitancy as far as the COVID-19 vaccine is concerned. And of course, people also carry a lot of rumor in terms of the vaccine leading to the death of a lot of children and so on and so forth. And of course, the linkage of the vaccine to 5G. I'm sure we are all aware of this. In terms of trusted voice, that will actually convince people to take this COVID-19 vaccine. So we can see on the screen there. But the summary here is that healthcare workers have a significant role to play as far as convincing the community, as far as convincing the populace on the need to take this COVID-19 vaccine. And as part of Africa CDC Vaccine Confidence project, we'll be targeting the healthcare workers. So what do we do as Africa CDC, to actually address some of these issues with regards to vaccine, COVID-19 vaccine uptake on the continent? From day one, as part of our COVID-19 preparedness and response strategy that is driven by a task force, endorsed by the assemblies of head of state and government on the continent, specifically our ministers of health, we did put in place a risk communication and community engagement technical working group. Because if there's anything we learned from the Ebola outbreak in West Africa from 2004 to 2016, is the importance of community engagement in any pandemic or epidemic preparedness and response. And also, make sure that for everything we do, there's proper coordination, there's cooperation, there's collaboration, and there's clear communication. So this particular technical working group continue to consult with member states, identify their needs, tailor it, to the specific context, so as to jointly come up with what is it that we need to do together to deploy the COVID-19 vaccine. We also, continue to coordinate weekly communication meeting with the different partners on the continent, especially WHO, to make sure that we all speak with one voice. And in that regard, we did put together a community of practice, that sit from time to time, understand what is happening in that in that space of COVID-19 vaccine hesitancy and uptake. Try to unpack this and come up with our best to engage the different member states. We also have what we call a mass media engagement strategy. And of course, and in this regard, we did deploy a lot of digital and public relation engagement. We did put together what we call rumor tracking that allows us to track the different rumor that is going on in that social media space and address that rumor. And in this regard, we work with a lot of partners, especially the UK Rapid Support Team, the Public Health England and London School of Hygiene and the Tropical Medicine. So Africa CDC also continue to provide a weekly press briefing on COVID-19, and a lot of emphasis, was actually put on community engagement. In fact, in some few instances, we have brought some civil society organization leaders, to be part of this weekly press briefing to allow people to understand the importance of COVID-19 vaccine. And we launched series of campaign. Most of this messaging, as far as the campaign is concerned, were actually informed by the outcome of our COVID-19 15 country perception survey. So most of the findings were translated into key public messages, that tend to, that speaks to the fact and try to allow people to see the reason why they need to take this COVID-19 vaccine. Colleagues, ladies and gentlemen, one of the lessons that we also learned from this COVID-19 pandemic and the response is the importance and the critical role of our National Public Health Institute. Because all this, the Africa CDC is doing in terms of risk communication and community engagement, the different campaign wouldn't have been possible at the level of member states without the National Public Health Institute. So again, let's continue to advocate for the role of National Public Health Institute in this particular space of risk communication and community engagement. So we need a lot of behavioral scientists. We need a lot of medical anthropologists to come into that space, within the context of our National Public Health Institute, to make sure that issue of misinformation, disinformation, continue to be addressed, and make sure that people, make themselves available to take up this shot. One other critical area that Africa CDC also worked upon is the need for a locally contextualized guideline. There is no one size fits all. So this Africa CDC, together with our MPHI and member states, did very well, to support member states in terms of, creating the necessary demand for COVID-19 vaccine. Of course, the political leadership also played a very key role. My colleague from Uganda actually talked on the fact that the President Museveni actually availed himself for this COVID-19 vaccine. That in itself, is a message to the populace. Myself and Director of Africa CDC just returned from Morocco. Just a statement from the Majesty of Morocco alone, actually mobilized a lot of young people to come out and take the COVID-19 vaccine. You could practically see people on the queue, very long queue, availing themselves for this COVID-19 vaccine. So again, the importance of our political leadership, to guide the pandemic response as a whole, and more specifically for the COVID-19 vaccine, I think is also very, very important. And this has been demonstrated, by what we are seeing in some of our member states. One other thing we did as Africa CDC was to deploy rapid responders to support the COVID-19 response. And specifically in terms of creating the necessary demand for the COVID-19 vaccine, we may use, and we are still making use of our community health workers, because these are health workers embedded within the community, and they have a lot of important role to play because they are trusted voices as far as the community is concerned, and they have been able to make sure that we generate the necessary demand for COVID-19 vaccine in some of our member states. As of today, we have deployed close to 19,000 community health workers in more than 28 member states to support the COVID-19 response, specifically the risk communication community engagement to create the necessary demand for the COVID-19 vaccine. And of course, we've carried out a lot of training. Risk communication and community engagement is also one of those key short-term course or short-term training, to equip our frontline responder with the necessary skill to create and generate the necessary demand for the COVID-19 vaccine. Of course, importance of digital platform is also key. Now, let me shift gear and emphasize the importance of partnership. because we know there are a lot of players, playing one key role or the other as far as this space is concerned. And as Africa CDC, we continue to work with different partners to continue to emphasize and re-emphasize that important message of the safety and the importance of this COVID-19 vaccine. And just some few months ago, we did sign a partnership arrangement with the MasterCard Foundation, that would deploy vaccines to immunize over 50 million people on the continent. And one key pillar of this partnership arrangement is risk communication and community engagement. And the emphasis here is to generate the necessary demand for COVID-19 vaccine on the continent. The second thing in this partnership arrangement is to set up, more COVID-19 vaccination centers, so that alone is an incentive for people to get vaccinated, especially when you know that the vaccination centers are just very close by in your own, within your community. So to conclude, let me say that the fourth wave is here. Some few member states have started experiencing that. And of course, we should anticipate that more and more countries will experience the fourth wave. Number two, risk communication and community engagement need to be intensified because we need this COVID-19 vaccine to bring us out of this COVID-19 pandemic. And of course, the presence of variants and low level of vaccine coverage means that for now, we have to continue to practice those public health and social measures before we are able to take the COVID-19 vaccine, to that level that will allow us to have what we call population level immunity and break the chain of transmission of this COVID-19 pandemic. And of course, without vaccine and vaccination, we will struggle as a continent. And in this regard, Africa CDC has put out there a COVID-19 vaccine development and access strategy to guide member states to navigate this very, very difficult terrain. So finally, vaccines plus vaccinations equal saved lives and livelihoods. Thank you, and I welcome comments, reflections, and the questions. Over to you, Chair.
Thank you, Taj. Thank you very much for that wonderful presentation. Now, colleagues, I know we are left with a very few minutes, and I've not seen any questions or comments on the chat, but please let's utilize the few minutes remaining and then ask a few questions or give comments before we close this webinar.
Dr. Ario, we have a participant raising his hand to ask a question.
Okay.
Mr. Norbert,
go ahead.
You can unmute yourself.
That's Norbert, right?
Yes.
Yes.
Norbert, go ahead.
Yes, thank you so much for giving me the floor. And thank you for all of the presentation. It seems that, for the work that has been done, I think I have a few comments and maybe a question too. I think, there is really need to target our messaging. As you can see, the reason for refusing or for hesitating this vaccine are not the same. I think we need to have a specific message for healthcare workers because they have been seen people dying of this disease. But why there is no uptake, I think, in most countries or among this group? I think because we need to know really what's happening in that group. For the general population also is different. I think maybe misinformation. It's why really targeting the message depending on healthcare worker or non-healthcare worker. And also for the population, I think the general message need also to go to the level of understanding of the population. I think having generic message maybe is one of our big issue that we need to tackle. The last thing I want to talk also, I think it's as we will see how as the coverage will increase, we will see more and more the issue of breakthrough infection. I think looking at some of the messaging, we are not really prepared now on really dealing and communicating clearly to the community why we can see this issue happening. I think for now, is not a big issue yet, but the more we will have people vaccinated, the more we will be seeing issues. This can be also a negative impact on when people saying that, because the general idea is that when you get the vaccine or other vaccine, you will not become sick. When we will see more people becoming sick, even with the vaccine, I don't know if we are prepared on this. Over to you.
Okay, thank you. Thank you very much, Norbert. I can see there's a question on the chat, I think. Yeah, my major question is on vaccine hesitancy. What can be done to really tackle it? Bob, do you want to take on that?
Oh, it's okay. Thank you
your network is very bad.
For raising that question. I think that was are you getting me now?
Yeah.
Hello. Okay. So I think I got the question. The question is from Augustine, and he is asking about what can we really do to tackle vaccine hesitancy. Well, maybe from the experience of Uganda and from the experience that we had from that study, as earlier on I said in the presentation, we have done so far two major things. One, the issue of holding the community dialogues. The community dialogues were held with the district leaders. Like, you know, the district leaders are one of the elites that are actually carrying a lot of respect and influence within the communities. So in this kind of dialogue, where we first ask you the questions that are regarding willingness, safety, and efficacy concerns, and then we go into a dialogue together on issues of the vaccine and its hesitancy issue, around the hesitancy issues of the vaccine. Then later on, we end up testing the knowledge of the very district leaders on now whether there is a significant change between when they came without any information, and then after the dialogue. We realize that the dialogues are doing a lot of work in changing the perceptions and then the attitudes towards the vaccine. So it is translating to vaccine hesitancy because of that number and the influence and the respect that they gain from the communities. That is one. Then the second one was issues of really people are talking out and saying the vaccine is not working and it's actually killing people instead. So doing short studies about whether the vaccine is actually benefiting was one of the impacting ones in tackling vaccine hesitancy. So in this, we see that we are able to show the public through the radios and the televisions that have been shown to be very key sources of our information and communication. We see that the public has been able to understand that surely from this study that was done within Uganda, the people who are severely infected with COVID-19, those who are actually critically ill, are not anyone who have ever had the vaccine, whether a single dose or even a double shot. So the benefit of the vaccine was one thing that they are able to see, and that has made the vaccine hesitancy one thing that we have tackled in the country. Of course, there are other measures. Dr. Raj's presentation, a lot of them have also been able to tackle vaccine hesitancy. That's what I could say for now. Over to you, Chair.
Okay, thank you. Thank you very much. I think there's also something shared on social media by Marie. You can actually read some information, I think WHO, information about how to address vaccine hesitancy. Marie, I need help with, I think this is Portuguese. I need help with the interpretation. Something on the chat, which I can't read.
Yes, I tried translating it, but it seems that the question is incomplete. So I will reach out to the participant to see what her question is. In the meantime, there is another comment from Grace on the chat. Dr. Ario, can you see it?
Yeah, exactly. Thank you. Thank you very much. Yes, Dr. Hian. Ian, are you there? Okay, I think the information from Grace has been read. There are reports that vaccine passports from African countries are not recognized in Europe. Okay, Raji?
Yes,
Raj.
Thank you, Alex. Apologies, I may have to jump onto another webinar now, but let me quickly respond to some couple of our questions here. On the issue of vaccines not being recognized in Europe, so when that statement came from the European Medicine Agency, we did contacted our colleagues at European CDC and at the EU in Brussels, and that has been largely addressed. You know, and I'm sure for most of our colleagues who are traveling now, you will agree with me that that problem does not exist any longer. Myself, I'll be going to I'll be going to Germany in 2 days' time, and I don't have that issue. So that has been sorted out, and I think even John and the EU ambassador to African Union did issue a joint press statement to that effect. Now, on the issue of breakthrough infection, so we're currently working with some couple of member states, you know, to really understand that terrain as far as the continent is concerned. Most of the studies in that aspect have actually come from outside of Africa. And as CDC, we're working with some few member states, you know, to understand that terrain. And as the data is begin to come out, I think we share that with them colleagues. But I completely agree with you, very, very important, so that we can address the concern of our populace as much as possible. I also agree with you that there is need for targeted messaging, which is exactly what we are doing as Africa CDC, to make sure that our messages are locally contextualized and they're also targeting the different population. For instance, we work with the faith-based organizations, we've worked with the artists, we've worked with the footballers, the athletes, and so on and so forth, just to make sure that we use these different, set of people to address a different concern as far as the COVID-19 vaccine is concerned. On hesitancy in general, I think Bob has nicely articulated there. Thank you, Chair. Over to you.
Okay, thank you. Thank you very much, Taj. Colleagues, I think our time is not, time is against us, and I suggest that we probably close. I know these are very important presentations, very important really to us. And you know, COVID has taught us a big lesson. And there are many things that we've learned because of COVID. We've never known this before, but I think now we do appreciate actually that COVID has taught us a lot. And vaccine hesitancy or misinformation is one of the key things that has happened. It was happening before, but we've seen it exaggerated during COVID. And we all know that, you know, because of the technology now, the technology has actually made things even worse. Social media was not there before, but now you can see what social media has done. And it's really, it's a challenge to us. And so it's causing us a lot of misinformation. Of course, there is also mistrust. There is mistrust to our own governments, mistrust to the health system, and then mistrust around the world as well. You know, thinking about that conspiracy theory. So COVID has brought in a lot, and you cannot even understand what to do. But we need to handle it. There is no question about that. So these two presentations have really, really brought this up. And I think many more are going to come. This is just the beginning. So we all know that we need to address misinformation. Misinformation actually costs lives. And it is also making countries not achieve their target as much as they want. But we also know that vaccination is probably the only tool which we have. And so we have to address it, and we have to make sure that actually people get vaccinated. Different countries have different targets. If Taj had time, he would actually tell us the targets that African countries have. But nonetheless, I think we shall discuss this many more to come. So thank you very much. Thank you very much, Bob. Thank you very much, Taj, for the excellent presentations. Thank you, Hien, my deputy, for the nice opening remarks and of course co-chairing this meeting. But of course, thank you also for the Yanfi Africa Network West Africa for initiating this kind of webinar. I think this is just the beginning. We shall make it rotatory, so that the different networks can actually organize this kind of webinars, which has been very educative to all of us, only that we've not had enough time. We may have to agree whether we go 1.5 hours or something like that, so that we cover more time, because I know many people would have wished to speak, but they cannot speak. So thank you very much, Ayanfi, as well. You've done us proud by organizing this webinar. And of course, thank you, our CDC team at Atlanta as well, who will collaborate very well with Ayanfi to ensure that we actually have this kind of webinar. And of course, thank you, our gallant participants, for logging in and ensuring that you really listened in. And I believe there are many other things and comments that probably you'll send us by email. So that said, I wish all of you well, and we meet again in the next webinar. Thank you very much. Bye-bye.